Hi everyone, in today's video we're going to look at some common abbreviations and terminologies that you need to know if you are in the NHS. If you are a returning subscriber, thanks for coming to watch this video, and if you're new here, I would encourage you to subscribe because you don't want to miss out on all these interesting and relevant information that I do share on this channel. In the NHS, you may hear of terminologies like ANP. ANP means Advanced Nurse Practitioner. ARCP. This is the annual review of competency progression and usually applies to doctors in training. It is a form of appraisal that is done on a yearly basis. The bleep. That's a picture of a bleep in the top right corner. It's a device used for communication in hospitals. Bloods. If you hear of the term bloods, it just means blood tests. BIBA, you may see this written in documents. It just means brought in by ambulance. BiPAP, bi-level positive airway pressure. CA means cancer. CS means clinical supervisor. CSR means clinical supervisor's report. CAMS or CAMHS is child and adolescent mental health service. You may hear the term crash team. That is the resuscitation team in the hospital. They generally attend to cardiac resuscitation or cardiac arrest calls. CQC is a Care Quality Commission. CCG, Clinical Commissioning Group. CESR is the Certificate of Eligibility for Specialist Registration. And you may hear of the term commode on the ward. That's a picture of a commode in the right-hand corner, and is used by patients who cannot mobilize to the toilet. DNA, did not attend. DNA CPR, do not attempt resuscitation. DATIX, this is a system for reporting adverse events. ED, Emergency Department. EAU, Emergency Assessment Unit. ES, Educational Supervisor. ESR, Educational Supervisor's Report. If you see FU written in a document, most likely it means follow-up. FT, full-time. FY1, FY2, Foundation Year 1, Foundation Year 2. If you hear the term hoist, that's a picture of a hoist in the top right corner. It's a device used to mobilize a patient from one point to the other. HEE, Health Education England. If you hear the term hoist, that's a picture of a hoist in the top. If you see LTFT written anywhere, it means less than full time. LMP, last menstrual period. MOFD means medically optimized for discharge. MFFD means medically fit for discharge. MHA, Mental Health Act. MHAA, Mental Health Act Assessment. MCA, Mental Capacity Act. NWD, Normal Working Day. OD, Overdose. OOH, Out of Hours. PTOT, Physiotherapy Team Occupational Therapy. PU, Passed Urine. PALS, or PALS, Patient Advisory Liaison Service. And this is the unit where patients put in complaints that they have against medical professionals. PICU, that's Psychiatric Intensive Care Unit. PPE, Personal Protective Equipment. QOF or QOF means Quality Outcomes Framework. If you hear the term reg, it means a registrar. Resus trolley, that's a picture of a typical resus trolley on the right hand side of the slide, and it contains the medications needed for resuscitation as well as other useful equipment. Respect form, it means recommended summary plan for emergency and treatment. Switchboard, that's the first point of contact for anyone who phones an NHS trust. SDEC or SDEC means same day emergency care. SHO means Senior House Officer. TBI means traumatic brain injury. TCI, you may see this written in notes, means to come in. T1DM, type 1 diabetes. T2DM, type 2 diabetes. TPD, Training Program Director. TTO, to take out. That's usually medications patients go home with after discharge. TOC, Transfer of Care. TWOC, or TWOC, Trial Without Catheter. Thanks for watching this far. I know the list is definitely not exhaustive. So if you have worked in the NHS for a while and you know of other abbreviations that I didn't touch on or other common phrases, please drop them in the comment section below because you may help someone. If you have any comments, please do so. And I'll be coming up with another video on common phrases to know in the NHS. Sometimes you get patients coming in saying that I felt so poorly, I felt sick, and other things that probably you may not be used to as an IMG who has recently started work in the NHS. So please subscribe if you haven't because you don't want to miss out on that video. Thank you so much for watching to the end. Don't forget to like, share, and subscribe. I will see you in my next video. Thank you so much for watching to the end. Don't forget to like, share, and subscribe. I will see you in my next video.